Hello, my name is Shannon Vogt, and I am a family medicine physician in Lexington. I'm also the clerkship director for the UK Family Medicine Clerkship, and I work in the residency here as well. So I just wanted to take a few minutes of your time today to talk about a really great way to integrate medical students into your clinic. I know sometimes taking a medical student can seem like a lot of pressure. So these are just some tips and some things that I think would be really helpful for you to know about our medical students and about how you can make their integration into your clinic easier and more productive for both you and them. So I just first of all wanted to welcome you to our team. Family medicine medical education is so important. I don't need to tell you all that we have a very big problem in our country that we don't have enough primary care physicians, and we definitely don't have enough family medicine physicians. So my goal on this clerkship is always to train our students well in the practice of medicine, but also to try to recruit them to family medicine, and also to just give them a great introduction to family medicine so that whatever they go into, they learn respect and admiration for what we do. So thank you for being a part of that. We could not do it without you. So today I just wanted to review with you the baseline skills of a medical student who's coming to your practice, in case it's been a bit since you were in med school, and obviously it's different than it used to be. So we need to know what are the things that they're capable of. You need to know what are their required experiences. So this isn't just a time for them to experience another location and another way of practicing, even though that is part of it. They do have things that they have to accomplish as part of this rotation. They have to see certain types of patients and illnesses. So we'll go over that. And then we'll end with my 5 tips of things that I have gleaned from others and from my practicing here over 10 years, how to work with students and integrate them into your flow. So we'll go ahead and start with the baseline training that your medical students have. So first and second year, the clinical training that they get, obviously in addition to learning pathology and anatomy and all those things, is they learn how to take a history and physical. Now, this is primarily hospital-based, so most students are pretty comfortable by the time they enter third year in the hospital environment, going into a room and gathering a history from a patient and performing a core physical exam and a physical exam that's focused on different areas. So we do teach them that. They should be really comfortable with that. Occasionally, they need a few reminders on the outpatient side, what kind of a history you're gathering. You're not getting everything, but just, maybe in regards to this current complaint or presentation. In orientation, we actually go over a little of the differences in family medicine, how you might gather a history for chronic diseases. And if a patient is there for refills, what kinds of things would you actually be asking them about? But these are the things that we hope you teach them as well. During the first day of family medicine orientation, we teach them a very detailed musculoskeletal exam. So we do shoulder, knee, ankle, back, and hip. And these are great ones for them to practice. So if someone comes in with back pain or hip pain, your student should know some of those common tests that you should do and be able to practice that on the patient. We also talk about how to kind of set an agenda with your patient and the outpatient side. We know that our patients come in with multiple concerns, and so we actually practice with them how to talk to patients and how to get out all of their concerns and set an agenda. And we talk with them about how to document those visits as well. We do a lot of detailed training on preventive health, so the USPSTF guidelines. So the students should be aware of USPSTF, and I would encourage you to quiz them on that. And we also talk about how to counsel patients and how to explain things without using jargon. So they might get to practice that as well. So in family medicine, as in all clerkships, they are required clinical experiences. So these are the things that we feel that students should be exposed to on family medicine. Obviously, they could be exposed to a lot more than this, but these are kind of the minimum things that we want them to see. Students just have to log when they have seen this. So they are required to see at least one of all of these types of things. So preventive healthcare means the patient was there for a preventive healthcare visit. This can't just be that you're incorporating it into everything else, but as we all know, there's specific guidelines for preventive healthcare if you're doing mostly that at the visit. So we want them to practice that. Back pain should be very easy for them to find and see, as well as cough, joint pain, and rash. So lots of skin complaints. We go over skin and dermatology in this rotation. So anytime you have a rash, that would be a great one for them to see. Social determinants of health impacting management. This is a new one this year. And the reason we've added this is because we want our students to start becoming aware of how social determinants of health impact management of care. This is going to be very easy, especially, throughout different AHEC locations. We know that patients struggle with access to care, struggle with access to medications or healthy diet. So those are kind of the things that we would want our students to be picking up on when they're interviewing patients. So this can be anything in regards to diet, access to places to exercise, or access to insurance, or financial stability, access to education. So all of those things could be impacting management. Asthma or COPD, atherosclerotic cardiovascular disease. So that's pretty broad. So that could include just someone with stents, someone with peripheral vascular disease, someone who's had a stroke. So any of those things in primary care that we would be managing with statins and aspirin and that kind of thing. Chronic kidney disease, we see a lot of patients who have stage 2, 3, and more chronic kidney disease, and we really want to train our students that this is a primary care thing that we take care of and that we manage and monitor. Diabetes, hypertension. Students do learn how to counsel on smoking cessation and weight loss, so we want them to practice this. And again, this should be really easy to find patients to practice counseling them on quitting smoking and counseling them on changing their weight or having more healthy behaviors. The only procedure we require them to perform on this rotation is some kind of vaccine or medication injection. Again, should be pretty easy, especially during the flu season, and we give a lot of flu vaccines. But if you have other procedures that you do in your clinic, we really encourage you to include your student and allow them to practice those. We talk with them and teach them how to do knee and shoulder injections. But if you do anything else in your clinic that's interesting, please include your student. If you practice at a nursing home or in an inpatient setting, take your student along. That would all be really great exposure for them. Or if you have residents who are going to OB deliveries, the student can go to that as well. The only thing we ask is that students work Monday through Friday and not nights on this rotation, but as long as it's during the normal working hours, we would love it if students had inpatient experiences or sports medicine or all those other things. We know that primarily they'll be in a clinic or outpatient setting, and that's what what is the most important. But if they're on inpatient for a week or something like that, that's fine. So if you have questions about that, just please email me. And I'd be happy to talk with you more. So my 5 tips for incorporating your student into your clinic. Number 1 is determine your student's desires and goals. Number 2 is work towards your student's independence. Number 3 is review your clinic to determine the best patients for your student. And number 4 is have your student present in front of the patient. Number 5 is use your student's documentation for your billing. So some of these are things that benefit us and some are things that benefit the student, or they benefit both of us. So goal setting. So I try to ask my students every week or every day, or when I'm working with them, what are your goals for today? Some students kind of struggle with this, but others do pretty well. I just tell them, I just want to know what to watch for. Are you working on your history taking? Are you working on your exam? Are you working on your differential forming? And so that way I can kind of watch. And at the end of the day, I can give feedback. These are really just great ways to check in and give constant feedback. So feedback is really important for our students. They want feedback. They want to get better. They don't want to just hear, you're great, you're good, nothing to work on. They want to know what to work on. So if they tell me I want to work on my differential, then I'll be kind of watching for that. And that way I don't overload them with all the things they need to work on. But I might say, hey, let's work on your differential for acute problems and making sure you have at least 5 things. So that is a really good way to check in. It also ensures you know what your student's interested in. Just because your student's interested in pediatrics, for example, doesn't mean you should only send them in to see younger patients, though. I think it's important to encourage them to go outside of their comfort zone as well, but just kind of help them if it's something that they're not as comfortable with. So this is just a great way to kind of know how to gear your teaching so you don't waste a lot of time like teaching your student all about something that they didn't really need to learn. Work towards your students' independence. So your students are going to love this because they love being independent. They are excited to be in the clinical environment. They want to be independent physicians. And it's going to help you because it's going to make your student way more helpful for you in your clinic. We really want to limit shadowing. So shadowing happens before med school and in first and second year. But by the time they're a third year, students really need to practice being the doctor. Obviously, we're there, we're in the same building, we're providing them a lot of oversight and we're walking through every step. It's not as much independence as a resident, but we really don't want them to shadow us unless it's something really complex that we just want them to see how we manage it. But for the most part, we want students to be independent. They go in and see the patient on their own and examine the patient and then come and present to you. And then you come in together. That gives the student some time to kind of build their confidence and work on that. That being said, you do want to set expectations. I know if a student goes into a patient room and doesn't come out for an hour, that's a problem. So you might want to tell like, okay, I typically spend about 15 minutes gathering a history and doing a physical or whatever it is that you think is appropriate so that the student knows how to best help you. If you have a patient that has a lot of problems and you don't want the student to get into all the weeds, you might say, hey, I really just want you to address their knee pain today because I kind of talked with them about all these other things last month. So it does help to set those expectations so that the student can feel more confident. Introduce your student to your staff. So all the nurses should know the student, the front desk, people should know them so that they can tell the patient, hey, he has this student, Jane, with him today, and Jane's a great student. That kind of helps build up that patient involvement as well. As the student goes through the rotation, you're going to increase their independence. So perhaps they've never done a pap smear. They might watch you the first time, and then the next time they might do it with your help. And then the third time you just watch. So as they go along, increase their independence and watch for that. We really want them to work up to seeing about 3 or 4 patients in a half day of clinic. So that's 6 to 8 in a full day. Students really can handle that workload. They get to that point, and I think that's a good goal because we're training them to be real physicians. So we know they need to be efficient as well, right? And some of the biggest complaints I get from students are about only shadowing. So I think that's kind of why I really want to emphasize that independence is because students really want to work hard. This is actually a good time to work them hard when they're really excited to work hard. I know we want to go easy on them and make it like fun, but they actually really enjoy the work. So picking your patients. So I like to kind of glance through my clinic schedule and try to find a good patient. So a good patient doesn't necessarily mean, any certain type. It just means that these are patients that maybe have good learning opportunities. It could just be that the student hasn't seen a certain required clinical experience. So I'm like, oh, this patient's a smoker. So you could go do some smoking cessation counseling for this one. It might depend on their goals. So if they want to get more comfortable with musculoskeletal complaints, you might look for that on your schedule. Acute patients are always good to see. That's going to help them prepare for their test, obviously. It's also good for practicing differential forming and treatment and management plans. I do know our students get a lot of chronic disease management, but if you work in a clinic that doesn't do as much of that, you might want to make sure you include that. So it's all about kind of the balance. Like we don't want it to be all acute or all chronic disease. We want them to do some preventive care, some well child visits, maybe some procedures or pap smears. So really it's all about diversity, right? We want our students to see that in family medicine, we practice in a lot of different communities, and we have a really diverse patient population in terms of what they come in with. And that's the beauty of family medicine, is that we take care of anything that walks through the door, right? In terms of complexity, I think obviously that maybe the first week you want to steer away from the super complex patients, and maybe stick with patients that aren't quite so complex. Or you could even have them shadow you for a very complex patient to see like how you manage that. But I think towards the end of the rotation, it might be good for a student to kind of get their feet wet with someone really complex. And I'll even say, hey, I think you can do this. Like, they got a lot going on, but you can handle it. And I think students appreciate that encouragement. In terms of timing, it just depends on your clinic and when you need to get out of there. I kind of front load my students a little bit. So I typically will have them see my first patient of the day if it's appropriate. And then they kind of see every other patient until they've gotten to 4. And then I let them finish their notes while I'm sort of finishing up. Or if I'm running way behind, I might say, I'm going to see the next 2 or 3 and catch up. You work on these notes and we'll plan on having you see this 11 o'clock patient or something. I try to give them a little bit of an idea of who they might be seeing so they can review the chart before. But generally we want them to see that 3 or 4.5 day. And it can depend on the timing who it ends up being, obviously. So presenting in front of the patient, this is a great tip. If you are wanting to be more efficient, you feel like a student is making you behind in your clinic. So we do want our students to present to us. We can't just let them kind of interview and then come in and just sort of interrupt and take it from there. We do need them to present to us because it's a key part of learning, and it helps them to practice that sort of medical decision-making, working on their differential and their plan, and just becoming more independent with your guidance. So one way to do this in a more efficient fashion, and this is something that I do typically once or twice a day, I don't do it for every single patient, is I have the student precept in the patient's presence. Now, this is where the student has interviewed and examined the patient, and then they come out. Instead of sitting there back there in my clinic, student presenting to me, I say, hey, let's go in the room and you tell me about the patient in front of them, and I'll just listen. And then we'll kind of come up, you'll tell me your plan. So then we go in the room, and I always explain to the patient what's happening. I say, thank you for seeing our student Jack. He's going to tell me what you all talked about and what he found. He's going to also give me sort of his plan, and then we'll, obviously go through it together. Just jump in if you need to correct him. Patients are fine with this. They actually really enjoy seeing that we, their doctors, are teachers. They really enjoy seeing that they're teaching too. So when they've studied this in a randomized trial, this method was actually strongly preferred by physicians. And I'll tell you why. It's because the patients feel heard. They don't feel like they need to repeat themselves again when you go back in the room. They hear what the student's telling you. They see the process. They see that they're being taken care of really well. And it just goes so much faster. When they interviewed patients and students, they preferred either method. So they were pretty neutral. So I think that this is a great method. It does increase your face-to-face time with the patient. So patients see that and understand that you're with them a little more. But it actually makes the encounter shorter overall. So this will save you time. So if you are running behind and you have a student, this is the best way to catch up, is to say, let's have you present in front of the patient. Documentation. So honestly, I've been doing this for a really long time, and the only thing that really slows me up with a student is documentation. But, if they document well, it just means that I kind of have to go the next day and sign their notes. But for the most part, this is where we can really use our students to our benefit. So we do expect our students to write notes. They're going to be doctors. They need to know how to write it out. They need to know how to use the EHR. So the great thing about this is that you can use your entire student note for your insurance billing, and it's completely legal. So you can use their note, and that can save you that time, because you know your student can see the patient, write the note. All you have to do is co-sign it. So the rules for co-signing it, you need to come up with a little phrase that you use. In our EHR, we have a dot phrase or like a little drop-down menu. You have to say that you were physically present. You can't just precept the student from your house, obviously. You were physically present at the time that you performed the exam, and you confirm the history with the patient, and you are part of the medical decision making. So we're best just saying to the insurance company, like, look, I was there, I confirmed this, I examined the patient, this is my decision that I am making, and the student's just documenting it. So how can you do that? So if your physical presence requires 3 people. So at some point in the office visit, the doctor, the student, and the patient must be together in the room. So all 3 of you. So that can happen after the students gather the information and you're just coming in to confirm it, or that could be part of your direct observation, or that could be the student, presenting in front of the patient. You can't just get the info from the student, go in by yourself, and then document that you saw them together. You could also re-perform the whole thing with the student there, but that would take a lot of time. So basically, at some point during that patient's visit, you all 3 have to be together, but it doesn't have to be, for the whole time or anything like that. This is a great attestation statement. I saw and evaluated the patient with the medical student. I discussed the case with the medical student and agree with the findings and plan as documented. I personally performed the exam and medical decision-making, and then you sign it. So if you write that statement and that was true, then you can bill with the student's note, and obviously read through their note to make sure it's accurate. So in summary, I hope that was really helpful for you. We're really excited for you to teach our students, but we really want to teach them well, because this is the only time in all of their medical school training that they will train in primary care and family medicine. So it's a great opportunity for you to influence someone, and hopefully for you to recruit someone to work in your area as well. So I hope that it was helpful. If you have any questions at all, you can email me anytime and let me know what you need, and I will get back to you. Thank you so much.